Good evening. We'll give people a few more seconds to join. All right, we'll go ahead and get started. My name is Danae Moore. I am president of the Virginia Academy of Family Physicians and an assistant professor in the Department of Family Medicine and Population Health at Virginia Commonwealth University School of Medicine in Richmond, Virginia. I'll be moderating this evening's session. Welcome to the impact of social media on the internet and social media and the internet on youth mental health, a VAFP VMAP virtual session. This is a very important and timely topic for discussion, and I hope you'll find the information shared in this session useful in your work with your pediatric patients. Just a few housekeeping items before we get started. This webinar is being recorded and will be posted on the VAFP website. A link to access the recording will be shared with all in attendance this evening. Attendees will be in listen-only mode to decrease background noise. Please type any questions you have into the chat box at any time. Questions will be addressed at the end to help manage time, and attendance is worth 1 CME credit. The link to complete an evaluation will be available on the last slide of the presentation and will also be posted in the chat box. If you are not a VAFP member and you would like to receive a certificate, please request it in the chat. Before I introduce this evening's speaker, I want to sincerely thank the Virginia Mental Health Access Program for their partnership on this session, most specifically Kimberly Lewis and Allie Singer-Wright, and the American Academy of Pediatrics for a grant to help support efforts to address pediatric mental health in Virginia. It's now my pleasure to introduce our speaker for the evening, Dr. Sandy Chung. Sandy Chung is the president of the American Academy of Pediatrics. Dr. Chung has held over 30 state and national leadership positions, including AAP Virginia chapter president and founder and medical director of the Virginia Mental Health Access Program. She is the CEO of Trusted Doctors, a pediatric practice of over 180 clinicians in Virginia, Maryland, and the District of Columbia, and serves as medical director of informatics at Children's National Hospital's Pediatric Health Network. Her passionate advocacy for child health and pediatricians has delivered major advancements in healthcare equity, mental health, EHR burden reduction, appropriate payment, physician well-being, and optimal child health policies. She is the recipient of multiple awards, including the March of Dimes Lifetime Heroine Award, recognizing a lifetime of community volunteerism, the Clarence A. Holland Award for providing outstanding contributions to the community and demonstrating leadership in the field of political advocacy, and the Virginia Chapter Child Advocate Award for standing up for the rights, values, and recognition of Virginia's children. As an avid educator of the next generation of pediatricians, her publications include articles on telemedicine, virtual learning, and health information technology. Dr. Chung received her medical degree from the University of Virginia and completed her pediatric residency at the Inova L.J. Murphy Children's Hospital. She has appeared in numerous media outlets, including the Washington Post, Wall Street Journal, NPR, Washington Business Journal, Virginia Business Magazine, Contemporary Pediatrics, and USA Today. Dr. Chung is the proud mother of 4 amazing children who teach her something new every day. Welcome, Dr. Chung.
Oh, thank you so much, Danae. Thank you for that wonderful or really wonderful introduction. Thank you, everyone who's joining me at the end of a busy day. It's always exciting to be able to talk to groups that I haven't had an opportunity to speak to before. So it's really fun to be able to talk about this really cogent topic that we were just chatting just before this presentation that not only affects young people, but really affects all of us. So I don't have anything to disclose. So just quickly, I just wanted to talk a little bit about mental health generally for children and the impact of the pandemic on children. COVID-19 and the efforts to mitigate the spread of the disease has resulted in several things that have led to exacerbation of mental health conditions, including changes related to access to care, financial strain, isolation, all the different things we had to do over those last few years that we know exacerbated mental health, and also things like domestic violence, and these things that we're still now really seeing in our kids and our young people that we'll be grappling with, I think, for decades to come. Not only that, COVID, the disease itself, we know impacted health. And unfortunately, and this was from May 1st of 2022, over 250,000 children in the United States lost a primary or secondary caregiver to COVID-19, with our Black youth experiencing the highest rates of loss. The consequences of orphanhood can last a lifetime, as we all know, and special attention needs to be paid to our young people who've gone through this. At the same time, our suicide rates have been increasing and now is the second leading cause of death for ages 10 to 24-year-olds. During the pandemic, we know that emergency rooms for sick visits went down, but the emergency room visits for children with mental health conditions went up. And that was true for even our youngest, school-age children as well. I remember talking to an ER physician in New York, and he was describing, the boarding situation where children, and this is true across the country and including in Virginia, where children were boarding in the emergency rooms and continue to do so while they're waiting for inpatient psychiatric beds. I remember talking to another pediatrician, a pediatric ER doctor in Northern Virginia, and she was telling me a story about a 7-year-old who was in her emergency room. What had happened was the mother of that 7-year-old woke up that morning and found her child, that 7-year-old, standing over her with a knife. And that 7-year-old proceeded to stab her. Luckily, she survived, but obviously the 7-year-old needs some help, right? And so, it's hard enough to find an inpatient bed for an adolescent, but if you can imagine trying to find a bed for a 7-year-old, they're pretty much almost non-existent. So that child ended up staying in the emergency room for almost 2 weeks while really not getting the care that they needed. And then, as we all know, emergency rooms are not the best place for a child and for anyone who's gone through trauma. And so, there are situations like this where we need to do something to help our mental health system. And it's not a new problem. Here you can see a graph that goes back to 2009 to 2019, which is before the pandemic. And you can see the percent of high schoolers who seriously considered attempting suicide has been increasing. And again, that was even before the pandemic, and it's only gotten worse. In 2020, there were over 6,000 young people who died from suicide. And so if you were to think about one airplane crash that happens in our world, it makes headlines, it makes the news. But if you were to put those 6,000 kids on airplanes, it would be about this many airplanes. And so that's happening every year, and it's getting worse. And we're not necessarily seeing as many headlines as we should, when we think about what we need to be doing to make this better. So I will talk a little bit about AAP. As Danae mentioned, I'm president of the American Academy of Pediatrics this year, which is a wonderful honor. So I do also then have a fair amount of information about what's happening nationally. And so I'll share some of that throughout my talk today. And so AAP, along with several partners, has published the Blueprint for Youth Suicide Prevention as part of the work on trying to address this issue. This is free. It's downloadable online. I would highly recommend looking at it if you've not ever seen it. It has very specific and concrete advice on what we can do to address youth suicide. How can we prevent this from happening? How can we do that in our practices, in our health systems, in our hospitals, in our churches, in our schools, in our organizations? And so really some good practical advice. So it was really a love of labor over many years. And so we're really proud of this and would recommend taking a look at it. Several of you may know that the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association in 2021 got together and declared a national emergency in child and adolescent mental health. And then a year later, so last fall, we renewed that. Not sure what's happening this fall, but I think the critical thing to recognize is that by declaring this national emergency, it's shown a spotlight on what was happening, all those airplanes worth I was talking about of kids who have perished. And it's shown a spotlight on that. And as a result, we have seen the US Surgeon General take it up. We've seen Congress pay attention to it. And so there's been much more movement to look at how do we improve access to mental health care for children and adolescents. But maybe, what if instead of relying on children to be more resilient, we instead create a world that's less traumatic? And so today I'll be talking primarily about what this means in the digital space. How do we protect children online? Kids who are under 10 years old right now have never seen a world or never known a world where you can't just where you can only just talk to the air, right? And the weather will somebody will tell you the weather, or music will play, and all you have to do is just speak to the air. And so this age group knows what it's like to be able to just look at a device and see someone from across the world, and that's perfectly normal. My husband's from Australia, and so my children's grandparents are in Australia, and so to them it's no big deal. Of course you see people in Australia every day. That's normal. But certainly it's a big world. And so what do we need to do in order to make sure that kids are taken care of? Last 2 years ago now, a year and a half, we at AAP had an opportunity to talk to Frances Haugen, who worked at Facebook. She was a whistleblower there who shed light on the algorithms that Facebook specifically was using, but really that all the vendors that engage in social media are using, and how they're designed to keep us attached to our devices. And kids know, kids care. This has, as you all know, AAP had a guidance years ago about limiting things to 1 to 2 hours of screen time. And so we received this letter, and it says, "Dear American Academy of Pediatrics, why should kids only have 1 to 2 hours of screen time a day? And I'm 8. Does this apply to 8-year-olds? I hope you know the answers to these questions. Sincerely, Bellamy Bokic." So the guidance has changed. So I guess that's good, Bellamy. It's not limited per se. But what we do know is that it's super important that you go outside and that you use your imagination and that you engage in activities other than your screens throughout the day. And if you're really little, you probably shouldn't be using screens at all, except for educational purposes. But we also know in the real world, in school, everything seems to be on screens. And certainly as they get older, screens are necessary for education. And so thinking about what do we need to do in this space? So talking about social media specifically, so this is from the Pew Research Center, and what this is showing is the apps, the social media apps that our adolescents are using. And so you can see in the first column there, it's from 2014 to 2015, and then the second column where the little circles are is what they're using in 2022. So you can see at the top of the list is YouTube on 2022, and there's no line there because YouTube did not exist in 2014. The next one is TikTok, and that did not exist. And so Instagram did exist, but it's obviously grown over the years. Snapchat, similarly. Facebook was much more popular back in 2014, and that has fallen somewhat now. My kids say it's for old people, which means I'm on it. Twitter, or now X, and then the other ones you can see here. But I think the point of showing this is really that things are changing rapidly. Things are changing constantly. You can imagine that, 6, 7 years from now, the list of apps are going to be totally different. So is social media all bad? No, certainly not. We know in social media that young people can find people like them. All of us can do that, right? So especially if you're in a marginalized population, you can find other young people like you, and that you can share ideas with, and that you can connect with. When we actually survey our young people, 90% of them say that they're using social media to talk to people they know in real life. So it's really a way of connecting. Back when I was a kid, we used the phone. So I used the phone and it was attached to a wall. And so I remember pulling that cord, the corded phone as far as I could, so I could go into a room to sit down, because so we all had ways that we communicate with our friends. And so now social media is part of that. We know that when used well, it can improve self-esteem. It can help kids with their identities and help them make new friends even. But of course, there are costs. There are costs to social media as well. It is a forum where when something's put out there, it stays out there. Bullying becomes permanent, stalking, all of those things. It can increase social anxiety, self-doubt. When everybody shows only their best selves on social media, it gives you that impression that you're supposed to feel that way too. And the reality is that's not true. As was mentioned, I have 4 kids, and I know the pictures I post. My 4 kids are not always smiling like they are in the photo that I post. In fact, probably seconds before, they were very unhappy with me because I was trying to get them all to smile at the same time. But the reality is, when we put pictures like that up on the online, and that's what people see, it gives this false impression that that's what life is supposed to be like, and that's how everybody feels. And when you're young and your frontal lobes are still developing and your brain's still developing, understanding that nuance is much harder to understand. By the time a child is 13 years old, ad tech firms have gathered at least 72 million data points on the children. And so that's concerning, right? As these kids grow up in this digital space, knowing that so much of their information is already online, how do we ensure that they're protected? The U.S. Surgeon General has taken this up as well. A few months ago, he made made headlines in the media when he said, you have to be older than 13 to participate in social media. I will say that AAP has not picked an age. It's really much more important that it's related to the child's development and the adolescent's development, and so there isn't really a hard cutoff on age. And then also, the type of social media and the social media that has protections for kids, that is probably more important than a specific age per se. But certainly our youngest children probably shouldn't be on social media if they're not ready for it. At AAP National, we've developed a center of excellence on social media and youth mental health, supported by SAMHSA, a federal agency. And so we're hoping here that we're going to be able to collect research and information and start to shine a light on what are best practices. Already it's live, so if you Google it, you should be able to find it. And on this website, there's a portal where you can ask questions as a clinician or as a parent or as a young person, and ask questions about social media and youth mental health. And it's pretty exciting. We're engaging a lot of young people in this initiative as well to make sure we have their perspective. And so we're looking forward to being able to produce more and more helpful information and guidance from that. In the meantime, on our parent-facing webpage, which is healthychildren.org, there's already a place that's been there for a while on how to develop a media plan for your child, and how do you sit down as a family and determine what's good, what's a good way to use media and devices in your family, and at what ages. Advocacy is very much a piece of this. And so I mentioned the data points that ad tech firms have on young people. And so protecting children's privacy is really, really important. And so recently we had an advocacy day, like the White Coat Days, but up on the Hill, up in DC. And we met with multiple legislators to talk about how do we keep kids safe in their information. There are 2 pieces of well, there's several actually, but at least 2 going through Congress now. One of which is the Kids Online Safety Act, and the other is the Children and Teens Online Privacy Protection Act. And again, the idea is to put in place and require that technology vendors protect the information that they have and have the ability, for example, for an erase button. If someone wants to erase their data for a young person, how do we ensure that that's there? It'd be great if it was there for all of us, of course, but certainly for our children, we should be able to remove that information that's been collected. So why is this hard? Why is this so different and so challenging? And the reality is apps like Facebook and Instagram, TikTok, et cetera, have been using psychology to keep us in place. And the psychology is very similar to what casinos use. And so if you think about if you've ever been in a casino, there's lots of lights and colors, but you'll notice that there are no windows. There's no windows because they don't really want you to know what time it is or how long you might have been sitting there. There are no clocks typically. The lights and the sounds tend to be more engaging. They even design the casino so that you're kind of meandering through it. There's not really a straight line to walk through it, with the idea that at some point you're going to stop and look at something. The other is this concept of near misses. So if you've ever, seen a slot machine or played with a slot machine, usually there's three things and you pull the lever, and if all three things match, then you win. So nearly always, there'll be a play at time when there's two of them are right. And so it makes it psychologically so that you think if you just play one more time, it feels like you're in control, right? If you just play one more time, the next time you're going to get that third thing and you're going to win. Not using cash, so using like swipe cards so that you're removed from how much you're spending. And then the sense of control. With the slot machines, for example, pulling that lever makes it feel like that you're the one that's actually doing that to make it so that you're controlling the rolling of the numbers. And nowadays it's not a lever, but it might be a button you push, but giving you that sense of control. So again, all of these things are, behavioral psychologists have studied and they've figured out, what keeps us attached to our devices. And so what happens in social media is they're actually doing the same thing. So fear of missing out, if you've heard of that. So there's this concept in the app world, which is called endless scroll. And so Instagram's a great example of that. We were talking about that a few minutes ago. And so with Instagram, when you're watching a video, right below it, there'll be another video, and then below that, another video. And so you can just flick your finger up the screen and you will see an endless scroll of videos. And the concept there is that there's a psychological phenomenon called fear of missing out, where essentially you're worried, subconsciously perhaps, that if you stop scrolling, that next video might be the best video that you could have possibly have seen that day, right? And so that fear of missing out is what's keeping us attached to our devices. Social proof is another example of a psychological tool that's being used by these vendors, where essentially by showing you the number of likes by another person, or maybe on Amazon, when you're buying things, you look at the number of reviews, those things, we're social beings, and those things tell us that other people approve of this thing, right? They approve of this movie, they approve of this product, they approve of this post. And so if other people like it, then it must be something likable. And then we're going to want to be a part of that. Reciprocity is a different thing, where if you've ever, this is pretty common now in texting, for example, if you like something or you love something, on a texting app or in Facebook or whatever you're in, if you do that, then the feeling is a social feeling, where if you post something, you expect people to like you back, and so forth. So that exchange of saying something nice to someone else so that they say something nice to you, and vice versa, is called reciprocity. And that is, again, another way that these vendors keep us attached. Scarcity is another one. So, lightning deals are a good example of this, where, gosh, if we don't buy this now, or urgency is the next thing, but same idea, where there's only a limited number of whatever it is. And if we don't do something right now, we're going to miss out on that amazing thing. Gamification, of course, is another thing where, if you do some things, you get rewards and you can move up to the next level. All of these things are psychological tools that these vendors are using. The reason why I bring this up is that often, when parents may be talking to you and saying, what do I do? My kids are on screens all the time. How do I stop them? And it's not fair for us to say to the teenager or the child, you need to stop. Just stop. Because they can't necessarily. There are these tools that our vendors are using, algorithms that are in place that are designed to make it so you don't want to stop. And so when you have a young person, an adolescent, again, whose frontal lobe is not fully developed, whose executive function is not completely there, asking them to take ownership of that and to just stop and fight the psychological tools is really not particularly fair. So I'll talk a little bit about what to do in a minute, but we'll give you few more numbers. The teenagers know it. This is not a surprise to them. So 72% of teens surveyed believe that companies are doing this to them. And you may even agree with that. If you think about whether or not if you're being manipulated or being kept to a device. Certainly, hopefully, after I went through some of the ways that you're being kept to your devices, you'll know that they're doing it to us. Another example is, if you watch Netflix or Hulu or any of those streaming apps, it's super easy to binge watch because now they even play the next episode and you can skip the intro, right? So our vendors make it really, really easy for us to stick to our devices. And they're hard to give up. So when this is another Pew Research Center survey, 54% of teens say it would be hard to give up social media. So some of them on the left pie chart, you can see asking teenagers, do they think they spend too much time on social media? And 36% say they think they spend too much time on social media, and then about half of them think that's about right. But on the right, the bar chart there, the question is, how hard would it be for you to give this up? And at least half of the kids think it would be really hard. And it's not just here in the US, it's around the world. So to orient you to this chart, the green bars are teenagers and the gray bars are the parents. And, the question was, do you feel like you're addicted to your device? And certainly that has been shown to be true across the world. And it's not just social media. Video games are another place. Video gaming disorder or video game addiction is a thing. ICD-11 actually has it as a diagnosis. And so we haven't seen it yet in our ICD-10s, but once we all move to migrate to ICD-11, gaming disorder is actually a diagnosis. So think about gaming disorder a little bit like you would any other substance use addiction. So the definition would include impaired control over the behavior, right? You can't stop yourself. Increasing priority, so gaming comes first. You continue and you continue even if it's not resulting in positive behaviors. So if your family is upset with you, your parents are upset with you, you're not doing well in school, you're not healthy, but you still do it because you can't help it. And then also it needs to go on for an extended period of time. There shouldn't be any other comorbid condition that's causing these symptoms. And it is creating distress or impairment in personal, family, social, in other settings. Their estimate is that it's about a 3.05% prevalence, which is comparable to OCD. And more than gambling disorders. So I think it's something, and this is in adults actually. It's children and adults, and so I think it's important to recognize that it is a real condition. Some of the symptoms include not doing well in school or at home, some withdrawal symptoms. It's not quite as bad as a substance use, but they may feel sad or anxious or irritable if they have to stop. They don't do other things. They don't do the activities. They don't play sports anymore. They don't go outside, or they don't do things they used to enjoy. They're not able to stop, or maybe they're lying about how much they're playing. Maybe they're not taking care of their bodies, and they're using video games to escape stressful conditions. But like I said, other than the symptoms can be very similar to addiction disorders, there is less of evidence that there's actual true withdrawal when you stop. And so it is important. So how do we manage this? You may have heard of boot camps. There are boot camps that say that they will help treat gaming disorder. This is true in several of the Asian countries, where you send the person off for a couple of weeks and they basically detox, where they're offline and they aren't exposed to electronics and electronic devices. The jury is out on whether or not these actually work. I was talking to a psychiatrist who specializes in gaming addiction disorders, and he said, in so far the studies are inconclusive as to whether or not those really work, because truly the child or the adult goes back home, back into their native environment where all the devices are there. It is important to look at other activities and trying to get the child engaged in other things. CBT, or cognitive behavioral therapy, works really well. In this instance, group therapy can also be really helpful. And often gaming sometimes is a self-treatment for another issue. So if a child has depression or anxiety, they may be using gaming as a way to treat their symptoms from their depression, anxiety, or ADHD. And so by treating those underlying conditions, sometimes the gaming disorder can improve. And so one thought is that, if they have anxiety or they're worried about what's happening in the world, when you're playing a video game, you are in control of that world for the most part, and you are in control of that behavior. It's also quite predictable. And so it is a space that feels more comfortable to you. I have 4 kids. My youngest actually has high functioning autism. And I will say that video games bring him peace. He's very, very comfortable there. He knows what's going to happen. He understands, he has friends because they're online, because when he's in person, that social interaction is really hard. But online, where he doesn't have to see anybody, there's no facial expressions, he actually finds a lot of comfort there. So games can have a way of helping kids and adults cope with stressful situations. This graphic I found online of what's some of the physical signs, because if you play video games, 6 to 8 hours a day, you can certainly develop physical symptoms as well. Things like carpal tunnel syndrome, de Quervain's, tenosynovitis. There's something called trigger thumb or stenosing tenosynovitis. Obesity and being overweight certainly can be a problem if you're not getting outside. Vision issues, headaches, and not sleeping well if you're playing video games all night long. All right. Wanted to talk a little bit about the newer technologies, so artificial intelligence and children. And so AI, we've all heard about AI and ChatGPT. Hopefully you've heard of by now. And so it's really fascinating to look at what's happening. It is happening very quickly. And I think one of the concerns is with children, how do we ensure that kids are going to be safe in the world of AI? So in this picture, you can see this egg-shaped thing in front of this young girl. And this is a device that exists today. And what it does is it records part of a parent. So basically it records the parent's voice. So mom or dad's voice, or caregiver's voice, and it records it. And then it can tell the child stories using that person's voice. And so I think the idea is that this device is supposed to tell bedtime stories to a child using a loved one's voice. But one can imagine if a child constantly is hearing mom or dad or caregiver's voice coming from this device, that at some point he or she might start having feelings towards it, right? And it doesn't take too many, you don't need to jump too far to think about how this could go badly. So when we're talking about social media depends on having us stay focused on the device, right? So it's called the attention economy. So in social media, the goal is to keep your attention on the device, and all the different algorithms are in place to keep you there because they monetize that. Well, in AI, it's a little bit different. It's not the attention economy, but rather it's the relationship economy. So the vendors that are going to win in AI are those who get you attached to their devices. Now, that might seem far-fetched, but if any of you have ever talked to your devices, Siri, Google, Alexa, and hopefully I didn't just activate all your devices, but if you've ever spoken to one of these devices and gotten frustrated at it because it didn't quite understand you, right? And you just kept saying the question over and over. You tried to say it louder, you tried to say it clearer, but you were getting frustrated with that device. Well, you in that way you have a relationship with that device, right? This you're in our minds, it's not quite an animate object, but it's not quite inanimate either, right? So we've all experienced AI already. There is a lot happening, and again, it's happening very quickly. Online, you can speak to some of your favorite characters. So for kids, there are a lot of video game characters. Like here, you can see Super Mario. You can chat with Mario and have a conversation with him. And the little bottom corner, you can see you can actually design your own AI. And so with AI, these are actually, almost like a friend, right? And so, in fact, Instagram actually calls it, or sorry, Snapchat actually calls it your AI friend. And so, as we're designing AI devices and things, we're designing friends for kids. And if we're designing friends for kids, how do you design a friend that's safe? How do we design a friend that's good for a child, that is healthy? And so, there's a lot of legislative work that we need to do, and advocate work that we need to do in space. So there are all sorts of things that happen in AI, right? So with ChatGPT, you've heard of, if you've not heard of that, it's really interesting. It's free, run by a company called OpenAI. And you can go on it and basically you can type text in, you ask it a question, but not only ask it a question, you can ask it to do stuff. For example, several of my colleagues, including myself, I've used it to write letters for patients. So if you needed, you can say, as a pediatrician, write a letter to a college justifying the use of an air conditioner in a dorm for a child who has asthma. And pretty much instantly, within seconds, it generates this very cogent, very appropriate letter that you can then edit and change. And what's interesting is that it's not plagiarism, because it's not taking text, it's not going out to the internet and, sort of our traditional searches that we think about. It's not going out to the internet and finding an example. It's actually writing it. Now, that does mean that it's not always right and that's not always factual. So it does need to be something where you take a look at it and edit it. But it can actually help us do many things. I think it's interesting to play with and think about different. If you ever have to write something, it's a really interesting way to get things started. I had to go on a trip recently, a vacation, and I asked it to plan me a vacation. I told it where I was going. I told it what kind of food I wanted, what kind of hotels I wanted, what time of day I wanted to arrive, and the dates I wanted to arrive. And it gave me a very legitimate itinerary, including airlines to reach out to and hotels to book, and sites to visit. And then I checked it against a real site, and it was spot on. So I think there's a lot of really interesting things to think about as far as how we can use what's called generative language AIs, or like ChatGPT. What I'm showing you here on this screen is text to image. So very similarly, you can type in a whole bunch of things and it will create a picture. It's not going out to the internet to find a picture. It's creating a picture. So the little one on the left, the text might be hard to read, but the text that was typed in to generate this picture, they're called prompts. Okay, so the prompt was a lovable Labrador puppy sporting a crisp white lab coat and stethoscope, extremely realistic, warm light, ultra high quality down to the hairs, 8K, full HD, very high detail. And then within minutes, it generated this picture. On the right, the prompt was epic cinematic playground, interior playground with animal cartoon theme, children's slide, rope, glider, fox. And that's what it generated. So you can see these are really amazing pictures, but they're not real and they are just computer generated. And if you don't like it, you can push a button and it'll just make another one. of course, we can imagine how do we then in the future determine what's a real image and what's not, right? And so, there are many ways that this can be helpful. But yes, the puppy has too many legs. That is very true. So, so things like that. In fact, the one of the initial issues was people and hands. It was very bad at generating hands, and they would just have these really bizarre fingers and things. But realize that these types of things have really just cropped up in the last few months, really in the last half year. Some AI work has been going on for decades. So I don't mean to imply that's new, but the vendors, some of these vendors that are creating things now, because it's open source and anybody can access it, and you don't need a super powerful computer, is that we're creating things super fast. And so this is only going to get better. So voice AI, that's another thing. So this, I'm not going to be able to play that particular picture, but so Brad Pitt was giving a speech, and this is truly Brad Pitt giving a speech, at least as far as I know. But what the voice AI was able to do is overlay other people's voices. So for example, Steve Jobs' voice, saying exactly the voice of, saying exactly the words that Brad Pitt was saying. So I went onto the website and created two voices, but I thought in this they're going to say AAP, but you can just put VAAFP in its place. And so I want you to hear these two voices. Here's one.
You know what? I think the American Academy of Pediatrics is the most wonderful organization in the world. It is the best advocate for child health and pediatricians. And when I see all the things happening in the world, I am so glad that as a member, I have a chance to help protect children and their families.
So for that prompt, I put in young woman, and then I typed out the text. Here's another one.
You know what? I think the American Academy of Pediatrics is the most wonderful organization in the world. It is the best advocate for child health and pediatricians. And when I see all the things happening in the world, I am so glad that as a member, I have a chance to help protect children and their families.
So in that one, I put older man, and then I did put American accents on. You can choose what kind of accent you want. You could make the strength of the accent. And again, these were just two examples. And if I just hit, regenerate, it would just give me more and more, literally seconds to do. And so one can imagine that going forward, as we're listening to things, as we're seeing things, especially online, or on different media, how do we know who's real, who's not? And this wasn't, a voice that somebody said, these weren't people who said these things. And so I think there are some significant considerations. One could also imagine, though, that there's some efficiencies here. Certainly, if we have voices that we can just create, as I think about being a chapter of a medical society, marketing is going to get a lot easier. You're going to be able to do things. Of course, that's a problem for those who do this for a living, of course. But there are things where this is going to be more efficient. Also, AI is being used in creative ways in education. Sal Khan from Khan Academy has created an AI that is basically a tutor. So every child potentially could have a tutor that learns exactly their learning style and can help them through the curriculum. So the tutor doesn't answer the question for you. It actually is, it's pretty impressive when you watch it. But basically, if a child answers a question wrong, it uses a little bit more of the Socratic method and asks a question, why do you think you got that wrong, or why, or maybe it doesn't ask it quite like that, but and walks them through thinking towards the correct answer. Duolingo is another one where you can learn languages, and again, it's just really fascinating to do. And then AI for people with vision impairment, so you can use AIs to look at things for you, and explain to you what you're seeing. avatars. So this woman here with the white lab coat's not real, so it's a generated image. And you can just pay a subscription fee and then just type words in, just use text, and then she'll say whatever you put in there. You can also, there's websites like the ones on the right where you can have famous people and you can just type in text and they will say the words for you. Lots of issues with this, of course, as you can imagine. And so I think, the good news and the bad news. So the good news is that there are people working on, how do you identify when it's AI versus when it's a real person? How do you watermark things? How do you do that? And so bad news is that as fast as people are creating things, there are, of course, people on the other end who are trying to break them at the same time. So there's that. You can talk to famous people, that are no longer alive. So this is a website where kids can go on, or anyone can go on and have conversations. Where father, his daughter was doing a project about Plato, and went online and had a conversation with AI Plato, and had factual information, and at the end she actually thanked him for his time, because she really felt like it was a real interaction. I had an interaction with Albert Einstein, so here, Einstein, this is not voice, it's just text. So hello, I'm Albert Einstein. I was born March 14th, 1879, and I conceived of the theory of special relativity and general relativity, which had a deep impact in science's understanding of physics. So I asked, how did you come up with E equals MC squared? And then he gives me an answer. And so you can just have back and forth conversations with the famous entity or person. So what do we do? So UNICEF has been thinking about this for some time now. And so they issued some policies on what to do. It's very high level guidance on AI and children. They have issued guidance for governments, for legislators, for communities, to think about how do we ensure that children will be safe in this space with AI. So, but of course, we need to be doing things too. And so I think understanding that there's a lot of conversation right now for all of the major vendors, Microsoft, Google, et cetera, Meta, who are working on AI and trying to figure out how do we do this responsibly. The key here to understand, though, is that AI affects all of us, but children's needs are very specific. And when we're having groups talk about the safety of AI, ensuring that we're also paying attention to children and children's needs and adolescent needs will be critically important. What we don't want is 6 or 7 years from now, if you remember that graph that I showed you of the apps, the social media apps that were not around in 2014, that in 6 or 7 years, there are going to be a whole bunch of things that aren't in place today that are AI oriented. And we don't want to be there and looking back and wondering, what could we have done differently now, like we are with social media. So really important that we continue to focus on kids and how this affects them. I did want to talk briefly about VMAP. Hopefully you've heard of this, the Mental Health Access Program. So as you're seeing kids in your practices and perhaps you identify gaming disorder, or you identify, and it's not an official diagnosis yet, or you identify issues with digital media or social media issues, or anxiety, depression, ADHD, bipolar, the other mental health conditions, including behavioral health issues, just realize VMAP is a free resource available to you. I founded VMAP, and let me tell you what happened. I had so this is before the pandemic in 2017. I had a 14-year-old boy with bipolar disorder, and his child psychiatrist had retired. And the family reached out to my practice and said, we got an appointment with another child psychiatrist, but it's 6 months from now, or 4 to 6 months from now. Can you refill his medicines while we wait for that appointment? So we went and we looked at his medicines, and he was on some pretty complicated things. So he was on 5 different medicines, several antipsychotics, and they were things that we weren't comfortable with prescribing. We weren't taught to. I was not taught to manage mental health conditions in residency. I was taught to identify if a child had depression, but then I was supposed to refer to a child psychiatrist. And so we said, well, we can't, and also Medicaid would not at the time would not pay for the medicines if a psychiatrist didn't prescribe it. So we said, we can't prescribe these, we can't refill them, but what we can do is try to find you care. So one of my nurses called and got access to an appointment. So we found a child psychiatrist who would see him in 4 weeks. So we thought that was pretty good. Well, unfortunately, during that 4-week period, he ran out of his medicines, and we didn't know that was going to happen. And when he ran out of his medicines, his bipolar disease got out of control, and he got into a fight. And he got into a fight in a parking lot near my office. And during that fight, he had a gun, and he actually shot and killed somebody. So that man lost his life, and that 14-year-old ended up in juvenile justice. And could that have been prevented? I think so. And so that led me to look for a solution. And I learned is that there were these mental health access programs. There was actually one in Washington, D.C., one in Maryland, and one in North Carolina, but Virginia didn't have one. And so what it was is basically there's 2 parts to it. One is learning how to do this work. Like if I knew how to if I knew how to use those medicines in a child, if I knew how to manage side effects, if I understood the disorder better, then maybe I would have been more comfortable. Plus, we had to make sure Medicaid would pay for the medicines, right? And then if I was able to talk to a child psychiatrist and ask them, what do I do? How do I take care of this child? Then things could have been different. And so that's what VMAP is. So it's 2 parts. So one is education. So I mentioned, learning how to do this work. We're lifetime learners as physicians. And so how do we learn how to help the kids in front of us? And so we have multiple parts to this. So the REACH program is a weekend-long program. So like a little mini fellowship where you learn very deeply, how do you manage mental health conditions in kids, including anxiety, depression, ADHD, bipolar. And then you have phone calls after to talk about real life patients that you're seeing and then do case-by-case learning. Project Echo is 1-hour sessions where basically you get a 20-minute didactic, and then after that you get phone call, you do case-based studies again. And that goes on for several months. We have quality improvement projects. We also have a guidebook that's published. It's free online that just sort of walks you through algorithms on what to consider when you're seeing a child. But when you start doing this, if you have a 7-year-old with anxiety and you're trying to decide, should you start a medication on the 7-year-old, then the VMAP consult line is available where you can just pick up the phone and call VMAP and speak to a child psychiatrist within 30 minutes. And then get guidance immediately. If you don't need a psychiatrist, there's also psychologists and social workers on the line. So if you're just questioning, where do I send this child? What do I need to do? Or if the child just needs resources. So let's say you have that 7-year-old with anxiety who needs a therapist, but you're having trouble finding one, or you don't have time, you can actually call VMAP, and the care navigators will actually, you just tell them, you'd call and you tell them you have a 7-year-old with anxiety who needs a therapist in your community, and they have Anthem insurance or they have Medicaid or whatever the case might be. And then the care navigators will actually call them. We'll call that family and help them find care in the community. So it's really great. This is just another way of looking at it. So first the educational piece, then you call VMAP, and then there's someone on the call center that will then direct the phone call to whichever resource you need. We cover the entire state, so it's available today. It's free of charge for everybody. It's Monday through Friday, 9 to 5. And so here you can see multiple health centers that are helping us. This is where the people answering the phones are. So this is where the psychiatrists and the psychologists, social workers, and care navigators are located. So far, over 1,000 people have been trained, primary care providers, over almost 5,000 calls now. It's a little bit older. And we've done 22,000 hours of training. Different types of training available. It's available to any primary care provider. So nurse practitioners, PAs, pediatricians, family physicians, all of us. And so if you go to our website, the latest versions will be up there. And then the guidebook, as I mentioned, we are updating it every year, basically. So some really good guidance in there on medications and screening tools and what to do. Covers topics like these. So disruptive behaviors, psychosis, substance use, sleep issues, and then your more typical things around anxiety, depression, and ADHD. And we're expanding our services. So we are expanding to ensure that we can cover younger kids, so 0 to 5-year-olds. And what we're looking for here, not so much the anxiety, depression, although there might be a little bit of that, I guess, but mostly behavioral issues, questions about autism, questions about behavioral issues, kids who are having trouble getting kicked out of preschool regularly, so you can call VMAP to ask questions. We have child psychiatrists and developmental pediatricians on the line as well. And so they can be helpful to you. And we've had, great feedback. I think those who have used VMAP have found value in it. And, I think having this is really exciting. I was speaking at a conference recently and a mom came up to me. I was talking about VMAP and a mom came up to me and she said, I think VMAP is working. And I said, what do you mean? And so she had a 24-year-old and a 17-year-old child. And when her 24-year-old was a teenager, she was having issues with anxiety and depression. And she went to her pediatrician and her pediatrician just didn't know what to do, just referred her. And this was several years ago. So the mom said, it took me almost a year to find somebody who could help my child who took her insurance. And then she said, my 17-year-old now is having issues with anxiety and depression. And that same pediatrician, when I saw him, knew exactly what to do with my 17-year-old. And I was able to get care right away. So that to me was a great example of just proof that this is working. So really exciting. The numbers here, it's also online, vmap.org. And you can call, you can even request a consult online if you don't have time to call. The consult's done over the phone, but you can make the request online if you need to, just to make it easier for you. So hopefully that is just a quick overview of VMAP. Hopefully it wasn't too much of a review for all of you. And that's all I have. So thank you so much for your attention. I'm happy to take any questions if we have any time.
Thanks, Dr. Chung, for this fantastic presentation. I know I've learned a lot, and I'm sure our audience has as well. We'll have a few minutes left for questions and answers. So if you would like to put your question in the chat, we'll get to as many as we can. And then perhaps what we could do is collect those questions and then Dr. Chung have you answer some of them offline if we run out of time. Okay, so I know I had one question, which is, what's been the most challenging patient and family encounter that you've experienced related to social media or internet use in your practice that you think our audience would benefit from learning from?
Yeah, that's a great question. I think I have not had one where I've heard of one, but I personally haven't had a patient that has been so addicted that they haven't been able to go to school, for example. Constantly all day long, though, we hear, and you don't even have to hear it. You can walk into the exam room and see it, right? When you walk into the exam room, chances are most of the kids are on devices, the parents might be on their devices too. And so what we mostly see is when we walk into exam room, especially with their adolescent patients, just trying to get their attention during the exam. Right. So they're still on their devices, even while we're talking, because they think I'm talking to mom or dad and I'm trying to talk to them. And so having a moment where you can just say, hey, we're going to be screen free in here today. I know that's super hard. And I know that that it's not what you really want to do right now, but it would be amazing if, we could just spend a little time talking and just put our devices down. And so I think for the little ones, often even the littlest ones will be on devices. Really just distracting them and giving them something else to put in their hands is helpful. I think really the key for us as physicians, and nurse practitioners and PAs dealing with families is teaching families how to engage with their kids that don't involve a device. The device is just easy. Right. It's an easy thing to, I had 4 kids. I had 4 kids under age 5. So I understand 100% how hard that is. And if you can put a device in front of a child so that you can deal with the other 10 things that are going on in your house, it's really, really easy to do. But I think what we all need to understand is that, especially once we get into social media and maybe now into AI, that what we're handing them is something that will be hard to stop because of the algorithms that are in place. And so I think just educating families and educating caregivers and parents about the harmful pieces that are there and the way that these are programmed so that they understand how serious it can be. Educational use of devices is fine. Like that's okay. And so if you want to watch a video with your child, and the key is with your child, right? If you want to watch a video with your 3-year-old and talk about what you're seeing together, that's perfectly fine. And it's a wonderful way to engage with your child.
Great, thanks. And then I see a comment in the chat about ACGME should be requiring more mental health training in pediatric residency, and family medicine residencies would benefit from that as well.
Absolutely. Yeah. And I think somebody must have heard you because the new ACGME requirements for pediatrics, at least, is now requiring, I want to say, 6 to 8 weeks of pediatric mental health and behavioral health. Of course, the challenge is that displaces something else. But I think that we recognize just across the board how important learning about behavioral mental health is in pediatrics. And so hopefully in family medicine, that something similar will happen, maybe, depending on what fits, I guess, in the curriculum. That won't be in effect until next year, so not this coming year. So.
Mm-hmm. All right, well, this concludes our session for the evening. Thanks again for joining us, Dr. Chung, and thanks to the audience for your kind attention. Don't forget to claim your CME credit for the event. You can use the QR code here on the slide or the link that Mary Lindsay White posted in the chat. And we hope you all have a great evening.
Thank you all. Have a great night.